Om. Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society at milestone of 2779 with the topic of audiovisual for health promotion. We are not limited ourselves to AYUSH only, as we all are well aware that we are conducting webinars on each and every topic related to our health. Today, we would like to welcome Dr. Sakat Kumar Basu from Canada and West Bengal and Dr. Suparna Sanyal Mukherjee Madam from Bolpur Shantiniketan. Welcome, Dr. Sakat. I would like to request you to please, yes, Dr. Suparna Sanyal Madam joined. Please start your place.
Yes, Suparna Madam will join shortly. Should I start then? Suparna Madam has just joined. Hello. Hello.
As you please.
Hello.
As you please.
Sharma, Madam, you please start. You can start now.
Basically, I was in class, online class research methodology. That's why I couldn't attend Sharmaji's calls. Please don't mind because I have to. I was in this class. Okay, thank you very much. Thanks for giving me another opportunity for this auspicious platform. I'm really very happy, and it is my privilege to share some views on this today's topic, this audiovisual technique and methods for this educational purpose and the purpose of the system where we are enriching and where we are evolving and sustaining in this today world, especially the health awareness. One of the best performance or one of the best situation where we can share this audiovisual technique for the health awareness. Health awareness is a very good aspect for our every aspects of life, for our day-to-day life, because every day we are suffering some one or other diseases because we are not aware. There are so many organisms and the bacteria, viruses, and fungi are there, which is not yet been invented. And science is not reached to that particular bacteria, viruses, or microorganisms. At the same time, the other ailment, dreaded diseases, which is caused for. This system, which is very important part of us, that is the audiovisual technique. So audiovisual, when you are implementing this audiovisual, that means you are just entering in your cognitive cells, this cognitive brain cells. You are just hammering to that. There is a technique called the Clacton and hammer, which is a very important part. And the audiovisual technique is also a part of that. Just because which we are not believing, if we can see is believing. So that's why the audio system and the visual system is also connecting with that. Audio, we can hear it. Who are not yet been heard, they can see it. And who cannot see it, they can hear it. So this the system, especially it is also applicable in case of the mentally challenged people and those who are suffering from epilepsy or the autism. This audiovisual health awareness is very important, because if the parents can nurture with this audiovisual system and the medicinal value, they can treat their children accordingly. And this system is incorporated in the very groups of people, especially in the medical science colleges and these hospitals too, because where they are going to be treated, the treatment is also very important for this audiovisual technique. And the doctors, it is also important in some cases, like the for the patient party, which is also important, because sometimes if the patient cannot survive, the patient party always blame the doctors. Doctors have done such and such operation, that's why this situation has happened. But if there is a audiovisual system, what doctor is doing in the operation theater, and the patient party, especially the house persons, the members of the family, can sit on the specific room, and they can see it, what is happening in the operation theater, and how the survive their patient, and how the doctors is operating. If they can see it through this audiovisual system, it will be there is so many cases could have been solved, because the family members of the patient could not be blame on the doctors, or doctors will be the same. And doctors is also the not yet been answering to the general mass. That's why it has happened. They can see it, and there is a footage with this audiovisual technique, and medical treatment can help it. At the same time, in case of the brain operation, or the any the part of our body, like the heart, brain, kidney, and then a liver, if there is some operation, and if there is a patient is suffering from a very dangerous situation, especially in the cancer treatment, if a capsule like camera can entering into the intravenous system, and this audiovisual technique, it is a very innovative point in the medical research. So that camera can taking the photographs of the cells, and how the system is going on, how the cancerous cells is generating, and how many cells this cancer cell has been destroyed, and what is the percentage ratio. If the capsule camera can take the photographs, and the audio through this audiovisual system, the doctors are observing, and if they are getting the photographs of that particular person, the particular point or particular segment where is the damaged more, and they can take the image, and by the way they can operate it on that particular part of the body, so that the patient can be saved very easily, and there should not be any trial and error method. So audiovisual technology in health and medical system is very important, and we can take part of it, and we can introduce in case of the any kind of operations on medical treatment. And it is also very important for the Ayush too, because Ayush, which is not yet been operated, and the operation system is not yet been started, or not yet been familiar for the patient, or the for the people at large. So this technique, if we can introduce in the Ayush, it will be the very good and very interesting and very scientific way, the way we can explore Ayush all over the world. And this is the system by which we can develop ourselves. Our cognitive brain cells could have been the more effective, and we can introduce a new era of medical science and medical treatment. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
Thank you very much, madam. Now I would like to request Dr. Sakat Kumar Basuji for his blessing.
Hello.
Yes, you are audible, Dr. Sakat.
अरे मैडम का हो गया?
हाँ जी.
Sharma ji, madam was able to complete, or she got disconnected?
Able to complete.
Okay. Thank you. Thank you, Sharma ji. It's a pleasure to be on this platform one more time. It's a very important topic that we need to highlight and discuss about, is about the use of audiovisual systems. Now, why audiovisual system is very important? It is because it provides you an aid in not only listening to a lecture or a concept, but it also provides you the background and imaginative or discrete abstract pictures and images of the stuff that you are going through. So it adds to our interest. Why are we so much intrigued about movies? Why do we like movies? Because it has an audio visual attraction. We look at the screen, we have characters that are acting out, and we have sound, we have a story flowing, and there is an interaction between those characters that draws our attention and keeps our focus in. If this could be the impact of a movie, we can well understand that how powerful that audiovisual system is. Say, for example, when a politician is addressing a crowd, when you listen to a radio, you do not when we do not get to see the face and expression of an individual, we are not enough motivated, or we may not be ably touched by the passion of his speech. But when we are able to see that individual and we see the expression in his face and the way that he is talking and delivering an individual lecture, it attracts it draws our attention, it connects us to the issues and the problem, and helps us in understanding the problem much better. Same goes with academics. Say, for example, even in our school classes or in the university or the colleges, in most whether it is in science, technology, humanities, or social sciences, everywhere that we go, there is the PowerPoint based lectures are a constituent part of our education system now. Even when we are having online system of education, even then there is a provision for audiovisual system presentation. Why is it? It is because it drags the attention of the audience in a much comprehensive manner where they feel connected to the issues. It is easier to reach your audience through this connection of having both the sound as well as some visual systems, because it has deeper and stronger impact on our brain, and we perceive the issues better, we understand the concepts better, and we also have a long lasting impact. Even when I am not in the class, the visuals that were shown, if they were very much mindful or meaningful, it will stay in my mind. And even when I am not in the class, or when I am studying back a few days after the particular lecture or class, it is still coming back into my it is still coming back into the reflection, highlighting my mind and helping me to reconnect with the thoughts or the lecture or the issue or the item down there. So medical science being, whether it is Ayush platform or conventional medicine or modern medicine, in whichever dimension we think in, there are so many concepts, services, and additional information, particularly connectedness with the patients, are an important aspect for a better treatment. Audiovisual systems can thus play a very, very significant tool, or a very, very significant role as an important and powerful tool in disseminating that information. And it could be done in various languages. If we talk about vernacular language, whether we could transfer it in Malayalam, Bengali, Hindi, Oriya, Gujarati, Marathi, in any language, you could reach the people or a particular community, even with a particular dialect within the same language group. And at the same time, if you have those visuals added, it adds credibility, it adds visibility, and it also adds meaningfulness to a dry lecture where it is better absorbed by the audience. So many messages related to various diseases, ailments, do's and don'ts that are essential for maintaining a better health, things that you should do as a part of your pharmacological preparations and stuff, everything, if it could go through an audiovisual present system, it has a stronger, long-lasting impact in our mind. Nonetheless, at this point of time, with so much technology available in our classes, such as smart boards, transforming slides, various kinds of softwares, various AI technologies made available in the class, this has very, very significant impact. Think about a biochemical reaction that we say undergoing into the stomach, say the hydrochloric acid helping in the process of digestion. Just helping to understand this information, if we have cartoons, if we have images that helps in understanding the chemical basis of digestion that happens in the stomach and how the stomach reacts and what we should do and what we should not do before or after eating the food, and how medication will be most effective depending on how the stomach reacts and acts to various chemicals, helps in building up not only better health resolution but a better health mandate and a training for the even the patients as well as for other customers in understanding how your medicine is working, how to get the best out of the medication that you are getting. whether it is telemedication services that a doctor, whether Ayush or non-Ayush is providing you from a remote distance, whether the medicinal preparations that you need to understand that is happening across various centers and interconnectedness, help in exchanging of information, whether you are networking, in every space and case, this is an absolutely important item that enriches the quality of the education, enriches the quality of the information dissemination of the quantity of information that you are trying to highlight and trying to disseminate to the people. So this is a very powerful technology that has come into play, but I do see an abuse of the system in many cases, particularly in the classroom situations where I see both students, research scholars, professors, and teachers are using it as a reading device. A PowerPoint tool or an audiovisual tool is not something that you look at the board and read from. The audience can see your slides, remember, or whether you are online, whether you are offline, everyone is able to see your slides. Your slide should be an adjunct to your presentation. What you're saying, they should corroborate, they should provide additional information, things that you could not deliver through your lecture. The images should be provided by your slides. But when you read from your slides, you are just reading from slide 1, slide 2, slide 3, slide 4, then you are just reading your blackboard. This is not your presentation. You are not being able to properly use your audiovisual system. But in vast majority of the classes, in every discipline, whether it's science, technology, medical sciences, everywhere look, you will see there is this problem of people absolutely abusing the system, not knowing how to use it properly. It is not for reading your slides. It is for use as an aid or a tool to your making your presentation. When you are effectively able to use this as an adjunct, powerful resource to your presentation, then your presentation becomes captivating and it reaches the audience. So it is very important that we look into high quality presentations. There are numerous presentations available on the YouTubes and other social media platforms. I encourage all participants and those who are interested in making better public presentation or doing better communication through use of audiovisuals to see how there are various very good presentations made on board and available on the YouTube platform, where you would see that the presenter is not even looking at the slide. He's so well versed which slide come after there. He does not even need to look back at the slide. He is just continuing the story by looking at you, by making his eye contacts or her eye contacts with the audience while the audiovisual medium is playing at the backdrop. Sometimes it is important to have a little video clip. Sometimes it is good to have a little documentary in between your talk, which strongly emphasizes the points that you have raised. So it depends on how you are going to use it. You may talk in the beginning and then have a few clips to highlight the point, or you may have simultaneous slide movement as you are talking through your presentation. There are various styles. There is no style that I can say is perfect. Every individual is different, and one needs to select, just like a writer. Your writing style is your own style. Use of audiovisual system in your presentation is your own unique signature style. You have to develop and figure out what suits you best, how you want to use it, whether it should be an overwhelming use of technology or whether there should be the personification and technology. 50-50% depends upon you. I personally feel that the technology should not dominate you. You should dominate the technology and use it in a way to reach out to the mind of the audience in a much better comprehensive way. And in areas such as medical sciences, in cases of Ayush, where many sensitive issues are needs to be discussed, say for example, contraception could be one issue, better food habits, better hygienic habits. If you are talking about, these are sensitive issues, and audiovisuals can help together in reaching out to a people in a much sensitive way if you know how to use this in a balanced manner. So with this, I conclude my presentation. Thank you, Dr. Sharma, for providing me this opportunity to share my thoughts. I think it was a very important topic, and thank you once again for inviting me. It's a pleasure to be with you on this platform. Thank you very much. Sharmaji, I'm done. Thank you. Hello. Hello, Sharmaji. Hello. Sharmaji, I am done.
शर्मा जी
Hello.
कहाँ गया?
There may be some internet issues and stuff. Okay, again, many thanks. I would be leaving the platform now. Thank you, madam, for your time. It has been very engaging listening to you.
Thank you.
And thank you to Ayush Samriddhi for providing us
Thank you.
both for this platform. Thank you and good night.
Okay. That's a very nice presentation. Thank you.